Immunization has contributed to Ugandans' health outcomes over the years, with significant decline in child mortality rates. In the past 2 decades, infant mortality dropped from 88 per 1,000 live births to 36 per 1,000 live births, and less than 5s mortality has decreased from 155 per 1,000 live births to 52 per 1,000 live births. Minister for Health Dr. Jane Ruth Acheng says there are still evolving challenges that threaten the progress of immunization.
The rising threats of outbreaks, numerous other outbreaks, and here in this case I will mention monkeypox, which underscore the need for rapid vaccine deployment to control emerging diseases. 3 is misinformation and disinformation spread through social media platforms, which pose a growing threat to vaccine confidence.
The Global Alliance for Vaccination and Immunization, GAVI CEO, Dr. Sania Nishtar, says Uganda has the largest number of antigens introduced in the primary health care that has improved the health outcomes of the population.
You should also be proud that you are going to launch the largest malaria vaccine program in the world, not on the continent, in the world. So this is by all means a very inspiring story. Me and my colleagues and our alliance partners were here to celebrate your 43 years with you. And as a new CEO, I was also here to pay my respects to the government and to the people and to your communities.
Health partners committed to increase on enhancement of surveillance and outbreak response to address vaccine-preventable diseases.
Innovations do not have to be shiny, bright objects. The way we work, programmatic innovations, extremely critical in getting to these zero-dose children. Why are they zero-dose? Because they are harder to reach. The proverbial low-hanging fruit has been exhausted as far as immunization is concerned. And now everything that we are trying to do is extremely difficult. So we need to work not in the way that we work to get immunization coverage from 30% to 80%, but very differently to get us to the next step.
Our efforts on equity, and again everyone's mentioned it, how do we reach those underserved children, how do we get rid of zero-dose children. There has to be a focus on communication and engagement, and we have to tailor that by district because there are different issues of access, disinformation, information. But what I'd also just like to put out there alongside utilising that creativity.
Through GAVI's health system strengthening grants, the country enhanced its ability to plan, monitor and deliver vaccines, thus contributing to improved vaccine coverage rates in hard-to-reach areas. Immunization has contributed to decline of outbreak of diseases like polio, measles and neonatal tetanus. Zahara Abigaba, UBC News.